So you heard just a few minutes ago from Nathan Friedland, works as an ER nurse at the Lakeshore General. You know all about the tough times that they're having there. When I say they, obviously if you're a patient, and I remember seeing so many emails, so many texts from people describing the terrible situation there. Aaron Derfel of the Gazette had a piece on emergency room waiting times, comparing them here, and I'll ask him to do that in a second to what they are, for example, in England. But then there's a story now beyond that. This is the news story. I guess it'll be in tomorrow's Gazette, on the fact that wait times, just plain old wait times for Quebecers to receive medical consultations keep growing longer and longer, despite what the government says it's trying to do and apparently is in the right or heading in the right direction to do. But Aaron, before we get to that part of the story, so we're speaking to this gentleman from the Lakeshore, and he acknowledges that, yes, things are bad, but explains why. And I want you to hear this clip here.
All we can do is stabilize, cross our fingers, transport, and hope the patient doesn't die. And that's totally unfair on the West Island, totally unfair to the nurses and doctors trying to save these people's lives, and nobody mentions it.
So he's making the case, and he's not saying, that they're doing things the right way. He's just saying they're kind of stuck in a situation where they can't make things better. What do you think?
Yeah, well, I 100% agree. It's they're caught between a rock and a hard place, and they don't have enough staff. They've hired, but there's a high turnover, and it's a collision of these two forces. You have the aging of the population, and you have burnt out ER nurses who are quitting, leaving those who are left, with more difficult, clinically more difficult cases, and so that's why they're in this situation. They're trying to stabilize, and sometimes, they, while tending to one patient, they're not tending to to another patient, and things can get worse.
And the problem with that is, as much as you can recognize that that's the situation, as I said to him, this is pretty obvious here, it's not something you could flip a switch and change just overnight. Exactly.
It's going to take years to bring the numbers back up. I mean, this is just a decision-making by the government of tragic proportions, and this is actually where one could criticize the former Liberal government, because, and even the former Péquiste government before them, that we knew our population was aging, and so why were we cutting enrollment in medical schools and cutting enrollment in nursing programs? And now, belatedly, we're boosting enrollment in these programs. It just boggles the mind.
That's part of the story, and I know you wrote about that yesterday. Just really quickly, if you want to summarize for people maybe didn't see it. So you actually went ahead and compared emergency room waiting times with, of all places, England, and tell everybody what you discovered.
Yeah, so in England, there's this growing outrage because 1 in 10 patients is waiting 12 hours. Their whole episode in the ER is 12 hours, and there's outrage. And, there's justifiable outrage. So there they have their cherished National Health Service, and it's under pressure there too. So there's an ER crisis. When you compare the situation with Quebec, 30% of ER patients are spending 24 hours on stretchers in hallways in ERs in Quebec. And this is somehow, being tolerated. The government objective is that no one should be spending 24 hours on a stretcher in the ER. And just that episode, the stretcher in the ER, that's not the whole ER stay, because people first, are in the waiting room after they register, and then they have to be seen by a doctor, and then they're put on the stretcher. And so that comparison, what that underscores is what is now not being tolerated in England is a far worse situation somehow our politicians are tolerating here in Quebec.
And let's continue along this theme from bad to worse. So you covered emergency room times, this particular situation here, as I started to mention off the top. The newest issue now is waiting times, and that's just for consultations with medical specialists. Where are we on this?
Yes. So the system works, you see your family doctor. It could be, you have a mole or something. You're worried about it. Mm-hmm. Then you have to, what that means is the doctor then contacts this répartition. It's this center that handles referrals. It's this bureaucratic thing. And then they put you on a wait list for a referral to a dermatologist. But, there are just 200 dermatologists for all of Quebec. So right now, when you look at the statistics just for dermatology, and these are not simply benign things. It's the longest list. It's 107,000 Quebecers who are just waiting for their first consultation with a dermatologist, and 66,000 of them are waiting past what is considered the medically acceptable delay. And it's the same thing. Well, not as bad, but you still have these long delays for orthopedic surgery, and that's why you have some people. There are two wait lists: the wait list to be seen by a medical specialist, and then often the wait list for the surgery. So that's why you have cases where from start to finish it takes 2 years to get your hip replacement, and that also explains why more and more Quebecers are going to the private sector.
Right.
There's a hospital in Laval to pay out of pocket after their taxes, $20,000-$30,000 to get this orthopedic surgery.
So the government clearly is aware of this. I mean, I've heard Christian Dubé speak to this lots and lots of times and suggesting that things are getting better slowly. Is that the case?
Well, no, that's not the case, because when you look at the trend lines, right? So there are 3 trend lines. The number of people waiting for a medical consultation, that's going up. Then you have the number of medical consultations past the delay, that's going up. And then, but the trend line for the medical consultations that are being carried out within the allotted delay, that's going down. So you want that to go up, and you want the other lines to go down, and it's the reverse. And so you have in total 831,821 Quebecers who are waiting for a consultation with a medical specialist, and it's urology, it's gynecology, it's dermatology, it's orthopedics, it's a whole bunch of gastroenterology, whole bunch of specializations, and it just speaks to, again, the enormous pressure that our system is under, the shortage of specialists we have, and it raises concerns about the potential negative impact on patients' health while they wait.
Where's the fix here, Aaron? I mean, again, we're in a situation where the government recognizes this is a problem and it's getting worse, not better, despite what they say. Yet, again, it's not one of those problems that you're going to fix in a day or a month or even in 6 months. It requires hiring, obviously, more doctors, more specialists in this case. Where's the solution here?
Well, this is something, sadly, I was predicting, during the acute phase of the pandemic, that this fallout is going to last for years. So, you have what I was mentioning a moment ago, the Centre de répartition des demandes de services, the CRDS. They have these, different centers that manage the referrals by region. And that was supposed to make things a little bit more efficient. They can improve the IT system. They're talking about, moving towards these electronic medical records that could somehow speed things up. In Quebec, we still use fax machines, and that is slowing things down. And then, in the long term, you're talking about training more medical specialists, but it could take 10 to 15 years to refer a specialist. Again, this raises the question as to why our governments in the past didn't see this coming. They should have seen this coming, the demographic graying of our population, but they didn't. They did the opposite, and now we're paying the price.
Aaron Derfel, with more grim news. There's never good news when it comes to healthcare. Aaron, thank you very much. I appreciate it.
My pleasure.